Okay, so ultrasound basics. Very important. So what is sound? Ultrasound is a longitudinal pressure wave. It has areas of high pressure and low pressure. The areas of high pressure are called compression, and the areas of low pressure are called rarefaction. And sound is at a frequency that's too high for humans to hear, so greater than 20,000 hertz. A transducer, which is this probe that we use to image the body, it converts one type of energy into another type of energy. And this is all based on the piezoelectric effect. So transducers have crystals in them. So here's your transducer, and you're going to have crystals. And what happens, and your crystals are what's responsible for making your sound wave. So the ultrasound machine, you have this wire coming out of the end of your transducer. The ultrasound machine sends an electrical current down that wire, and it hits these crystals, and it causes the crystals to vibrate and change shape, which causes the crystal to emit a sound wave. The sound wave goes into the tissue, bounces off a structure, and then comes back to the transducer. When it comes back to the transducer, that echo or reflection hits the sound wave, hits the crystal, and that crystal again vibrates and changes shape and converts that echo or sound wave back into an electrical charge, which travels down the wire of your ultrasound probe and into the ultrasound machine. So your crystals inside of this transducer are responsible for changing that sound or the electrical pulse into a sound wave, and then that sound wave back into an electrical pulse, because ultrasound machine, which is up here, only understands electronics, where crystals only understand really the sound waves. So it's converting. So transducer converts the sound waves from one form to another. And ultrasound's all based on the pulse echo principle, and this is the fact that the sound wave goes into the tissue, bounces off a structure, and then an echo returns to the transducer. And that's how we get our ultrasound images. So we have our transducer, our black sound wave going out into the tissue, bouncing off our structure, and then the red lines are the reflection or the reflected wave or the echo coming back to the transducer. Okay, so what is a transducer? This is the ultrasound probe that we use to image the body, and it converts the energy from one form to another. It has all these crystals, which we also call elements, and they're responsible for generating the sound waves. We name transducers for their shape, how the crystals are laid out, the arrangement of them, and also the range of frequencies that the transducer transmits at. Transducers transmit the sound waves at different frequencies, and we measure that in megahertz. So here's all the different types of transducers that you can have. So there's many, many, many types. And we pick a transducer because they all penetrate at different depths to the tissue and look at the tissue differently. So we have to know which transducer fits which part of the body that we're looking at. So transducers contain one or more crystals, and the crystals convert the electrical energy into sound energy and sound energy back into electrical energy. We call this the piezoelectric effect. There's two basic types of transducers. You can have a mechanical transducer, which has just one big crystal, and the image is generated by a motor that moves the crystal, which allows you to have sound waves coming out at different portions. Or most transducers today are what we call array transducers. These are transducers that have multiple crystals in them, and they use various methods of focusing and steering to create the image. And the crystals are all arranged in different layouts depending on the type of array transducer. And the crystals also can be fired in different sequences, and that also depends on the type of transducer. So most transducers today, when we're talking about a transducer, is going to be some type of array transducer. Mechanical transducers are kind of the old school technology. So there's two basic transducers, your two bread and butter transducer, a curvilinear transducer and a linear transducer. For breast imaging, we use linear transducers, and this is where your crystals are arranged in a line. For imaging deeper in the body, we use a curved or curvilinear transducer, and this is where your crystals are arranged in kind of an arc, in a curved line. So for a linear transducer, the crystals are arranged in a line, and your crystals, your lines radiate out from that. So it creates a rectangle image. So here's your crystals. Your lines travel out straight, which ends up making a nice rectangular shaped image. So this is your linear transducer. Your curvilinear transducer, your crystals are arranged in an arc. So your crystals travel out in slightly different angles, which in the end gives you a sector-shaped image. Oops. So how your crystals are arranged determines the shape of your ultrasound image. Curvilinear transducers generally are lower frequency transducers, so they penetrate less deeply in the body, penetrate more deeply in the body. So we use them more for like abdomens and pelvics, things where you need a lot more penetration. Where your linear transducers are a lot higher frequency, so they have less capability to penetrate in the body, and so we use those for superficial structures like breast, thyroid, scrotum, that type of thing. Resolution. So there's 5 types of resolution on ultrasound. Resolution is our ability to distinguish between 2 different structures on an ultrasound. So each one of these types of resolution contributes differently to how we pick up structures on the ultrasound. The first type is axial resolution. And this is where we try to distinguish between structures that are parallel to each other along the ultrasound beam. So we need a machine or a transducer and a machine with good axial resolution so that we can distinguish these 2 structures from one another. A lateral resolution is our ability to distinguish between 2 structures that are perpendicular to each other along the ultrasound beam. And then elevational resolution, this is where along the 3rd dimension of the beam, the height, we want to distinguish between 2 structures, one on top of each other. And contrast resolution, this is ability to differentiate between different shades of gray on ultrasound. Ultrasound's all about black and white and gray. If you just had one shape of gray, it'd be really hard to see different tissue types. You need many, many different shades of gray. And then temporal resolution, and this is ability to track how an object has moved over time. So frame rate really affects temporal resolution. If it takes a lot longer to do something, meaning a decreased frame rate, that decreases your temporal resolution. So how do we get an image? So we have our transducer, and our transducer sends a sound wave into the tissue. The sound wave encounters a structure, and then an echo returns to the transducer. So we learned about echoes earlier today. An echo is a reflection of that sound wave. It's the signal that returns back to the transducer. It's what gives us our ultrasound picture. Ultrasound imaging today is called B-mode imaging. And this means that each one of these echoes that returns to the transducer on our ultrasound image, it gives us one little dot of information on that ultrasound image. So if you think of your ultrasound image, it's made up of thousands and thousands and thousands of dots. So that's how many sound waves and echoes are going back and forth between the transducer to create our picture. So as the sound wave encounters a structure, part of the sound wave goes back to the transducer as an echo, and part of the sound wave keeps going deeper in the tissue until it encounters the next structure along its path, and another echo goes to the image. You have another echo here, and then part of that sound wave goes back up, and part of the sound wave keeps going deeper, and so on, and encounters another structure, and you get another echo. So as you're traveling along, you get multiple dots of brightness. When you get a whole row of dots all the way along, it gives you a whole row of information on your ultrasound image. We call this whole row of information a scan line. Your ultrasound image is made up of hundreds of scan lines. And it's all these various different dots of brightness. So each dot is a different shade of brightness, and it all depends on how strong this echo is returning back to the transducer. So if this sound wave encountered a really strong type of tissue, a strong reflector, it creates a really bright echo coming back to the transducer. If it encounters a really weak echo, just barely has an echo, you're going to get a really, not a very bright dot. So the brighter the dot, the stronger the echo. And we learned that as far as our anechoic means no echo, hyperechoic means a really strong reflection, hypoechoic means a really weak reflection. So your dot of color on here corresponds all these different shades of brightness. So that's how we get our B mode image. It's called brightness mode, made up of lots of shades of brightness. And that translates into our scan lines. A whole line of these brightness dots, or echoes, reflections, makes up a scan line. And multiple scan lines together makes up our big image, which is known as a grayscale image, meaning made of lots of different shades of gray. So grayscale, and that just means our whole image made up of a whole bunch of different shades of brightness of all of our dots, and made up a whole bunch of scan lines of dots together. So we call ultrasound grayscale, our image grayscale. And that means there's many shades of brightness on this image, from white to gray to black. And each one of these little dots is a pixel. If you think of a computer screen made up of lots of little pixels, each one of these is going to complete our picture. Our whole ultrasound image, the shape of it, which we learned is determined primarily by the transducer, the crystal pattern, is called our field of view. So depending on how your crystals are arranged in your transducer, your field of view or image shape can be very different. For linear transducers, we're always going to have a rectangular shaped image. Curvilinear transducers have a sector-shaped field of view. All right, so we're going to get into the anatomy of a sound beam now. Okay, so a sound beam as we're going out always starts as the same width of the transducer, and then it comes inward until it gets to our narrowest point, and then it widely diverges. The area closest in here between your narrowest point and the transducer, we call this the near field. The area from the narrowest point, to the end of the sound beam, wherever that is, we call that the far field. And the narrowest portion of our sound beam we call the focus. Resolution is highest in this area where the beam is narrowest. We learned earlier in the artifact section that we have two objects side by side. Anything outside the beam we can see as a distinct separate structure. So in this portion of the beam, the ultrasound machine would see two different structures, where if the same structures were both in the same part of the beam, the ultrasound machine would only pick that up as one structure. So the narrowest portion of the beam is going to be our highest area of resolution. We can pick up the most in that area of the beam. So this is why we have a control on an ultrasound machine we call the focus. In ultrasound, in breast imaging, we want to use what we call multiple focal zones or multiple foci. Everywhere we put a little focus on the ultrasound image, we narrow the beam, ultrasound sound beam in that area, which creates an area of high resolution. So here's our near field. In the near field, the beam is gradually tapering to where we get to our narrowest point, which is the focus. And then in the far field is this area, and this is the area of the beam where the beam starts wildly diverging. So resolution in this area, the near field and the far field, is lower than it is at the focus because the beam, the sound beam, is wider in these areas. The narrower the beam, the higher your resolution. Frequency. Frequency is the number of sound wave cycles occurring per second. So a sound wave has an area of high pressure and an area of low pressure, the compression and the rarefaction. One area of high pressure and one area of low pressure together is called one sound wave cycle. So a complete cycle, sound wave cycle, however many of those occur in 1 second, is called the frequency. So when we're talking about frequency, we use hertz to describe frequency. 1 hertz is 1 cycle per second. In ultrasound, we use megahertz, or 1,000,000 cycles per second. Ultrasound has a frequency of 20,000 hertz or higher. This is how we create ultrasound. Ultrasound used to capture images uses 2 to 20 megahertz. So we're talking about 2 to 20 million sound wave cycles per second. And this is how high of a frequency we need to be able to make an ultrasound image. In breast imaging, we want to use the highest frequency that we can. The higher the frequency, the higher the resolution. But the higher the resolution, the lower the penetration. So in the abdomen, we have to penetrate a great deal. So we have to use a lower frequency transducer, meaning we can't see as much. The resolution is a lot less, but we have the ability to penetrate. In the breast, we don't have to penetrate as much, so we can use a higher frequency transducer, meaning there's more sound wave cycles per second, which gives us a clearer image, but we lose that ability to penetrate, which luckily in the breast we don't have to worry about. Usually between 12 and 14 megahertz, most commonly. Yep, so we use a linear transducer, and we use a high frequency transducer. On the market today, there's transducers between 2 and 20 megahertz. This is what they sell out there. When you get too high of a frequency, you lose your ability to penetrate. So usually in breast imaging, we cap out somewhere between, I've seen 16 megahertz used, but you start losing your ability to penetrate. So usually 12 to 14 megahertz is what we want to use. It depends on what transducer you're using, like how much you're penetrating. So usually intercavitary probes have a little bit lower frequency, but a little bit higher than curvilinear. So it just depends.
So not over 20?
All right, image dropout. So we worry about getting dropout. And dropout is a line of information on the ultrasound image where we don't get any information. So we have our ultrasound image, and it has a picture throughout the whole image. But if you have dropout, a whole line of a whole scan line, or all those echoes returning from that section of the image is gone. So we don't get any information from that section. So we don't want dropout on our image because it obscures anything that could be in that pathway. So you can get dropout in different ways. You can get dropout horizontally or vertically. Broken crystals and lack of ultrasound gel are two reasons why we get image dropout. Broken crystals look like this usually. You start seeing areas where you can't see any sort of picture. With a lack of ultrasound gel, if you don't have enough gel, then you get image dropout in the area that there's no gel. So if you start seeing dropout in an area of image, put more gel. And if it fixes the problem, you know it was just a lack of gel. If it doesn't fix the problem, then you may have a broken crystal. And depending on type of transducer, you can get a horizontal band of dropout or a vertical band of dropout. And the only way to fix a broken crystal in a transducer is to get a new transducer. You can't, not anything that we can fix. Frame. So frame rate is really important in ultrasound imaging. A frame is one ultrasound image, one complete image made up of all the scan lines. So if you think of the old days when they would draw pictures, on a book and then flip through the pictures of the book to kind of create a story. Same kind of thing with ultrasound. We have all these different images, slices of information, and the ultrasound machine stores all of these in the memory. And then when we're looking with our ultrasound probe at all these slices, it's pulling every slice one by one out of the memory as we're going along. So one image we call a frame. Multiple frames together, the speed that we travel through all those multiple frames, we call that the frame rate. Real time is when we're traveling at a speed, the machine is releasing these frames at a speed of 15 frames a second or greater. When we're traveling in real time, it means when we're moving the transducer, what we're looking at on the screen moves at a rate, like such as the heart beating, as it would seem to be moving at their normal rate in the body. So we're keeping in time, real time, with how that structure is really moving. Often frame rates measured in hertz. So it's advantageous to have a high frame rate in the body because you like to see structures moving as you move in the body. So it's important to know what decreases frame rate. So increasing the size of your field of view. There's settings on the machine that can do that. Using more focal zones, increasing your depth, and then also using Doppler, power, color, or spectral Doppler. All these are things that decrease your frame rate. So it gets us further away from imaging in real time. This is most important in fields like echo, where we're looking at the heart, or fetal imaging, where we're looking at a moving baby, or it's always a trade-off between wanting to get the highest resolution by using lots of focal zones and getting a picture that's moving in real time. So we're always kind of struggling between those. Fortunately, in the breast, we don't really care if things are moving at their regular time in real time because we care more about resolution. So we often do things that decrease the frame rate in breast imaging to get highest resolution. Pre and post processing. So what happens is the ultrasound machine takes a frame or an image and they store that in the system memory. Anything that we do to that image to change that image with the ultrasound buttons on the machine before that image is stored in the system memory, we call that pre-processing. This is when the image is still live before it's put in the system memory. once we hit the freeze button on the ultrasound machine, that frame is now getting stored in the system memory. And anything that we do to change our image after that image is frozen and it's stored in the system memory is called post-processing. So there's different controls on the machine that we can do only while image is live. And then there's some controls that we can do both while live and then also while it's frozen, the image is frozen. So we'll learn more about those in lab. One of the controls that we see this with is with the zoom control. So zoom is a magnification of an ultrasound imaging. And there's two types of zoom. One zoom is a pre-processing type of zoom. We call this right zoom. And we have to zoom while the image is still live before it gets frozen and stored in the system memory. And what happens is when the image is live, as the magnification occurs, the ultrasound machine rewrites the existing pixel data. So you can zoom an image at a higher, less degradation of the image resolution as the image is magnified. Where if we freeze the image and it gets stored in the system memory and then try to zoom, all that ultrasound machine is doing is magnifying the existing pixels. So in this type of zoom, read zoom, you get a lot more of image resolution degradation as we're zooming. So basic ultrasound controls. This is actually our machine here in the lab, one of the GE machines. So we've got our trackball, which is our ball in the center. This is a movable ball that we have on the keyboard. And it allows us to usually move things to different areas of the screen to select different things. It allows us to scroll through certain machine functions, so it's kind of our all-purpose ball. We use it to place calipers on different parts of the screen. We have our calipers and set button, which our calipers are a measure button here, and then our set button is usually one of these buttons along here. Which allows us to measure things on the screen. We have a store or print button, which is usually one of these buttons over here. And after we use this freeze button to freeze our image, we can store that image into the ultrasound machine hard drive for later so we can pull up that image. A freeze button is this image button here, and it allows us to freeze the current image that's on the screen. And then we also have a control called Cine Loop. This allows us to scroll through all the frames or images that are stored in the ultrasound memory, system memory. And we do this by freezing the image and then using the trackball to scroll frame by frame on the ultrasound screen. You can actually see the different images as you go through. And this is really helpful when we're trying to catch something that's moving fast and we maybe have missed it, so we can hit freeze and then scroll backwards to get that information or get that image. All right, so brightness, there's three main brightness controls on ultrasound. We've got gain, TGC, and output power. So we learned about B mode. This is brightness mode. These are all these little echoes that come back to the transducer. Each one of them creates a dot of information. The color of the dot, either gray, black, or white, depends on the strength of the returning echo. So multiple echoes create a scan line, a line of dots, and multiple scan lines create an image. There's three different controls on ultrasound, gain, TGC, and output power, that create how bright an image is. So you can see this image is really bright and this image is really dark. So we want to find a happy medium between that. So gain is our primary brightness control, and this increases or decreases the image brightness. And this is what our gain button looks like. Often it'll have a B on it for brightness mode. Sometimes it has a G on it for gain, depending on the machine. And what happens is we are boosting the signals that have already been received by the ultrasound machine. So it's not affecting the pulse that's going into the body. But the signals the machine has already received, it boosts or decreases those signals, and it changes the brightness level of the image. So if my gain is set really high, you're going to get an image that looks like this. If my gain is set really low, you're going to get an image that looks like this. So the first thing you want to do when you get a breast ultrasound is you want to set your gain to where the fat is a medium gray color in the breast. Gain is the most used control on the ultrasound machine. During the course of an ultrasound, you're going to use it many, 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 many times. You should always be touching your gain. TGC is your next brightness control. Time gain compensation. Similarly to gain, this does not change the strength of the pulse sent into the body. Rather, it's just boosting the signals that are already in the ultrasound, received back to the ultrasound machine as echoes. And what gain does is it corrects for attenuation. So attenuation is when the sound beam loses strength as it penetrates into the tissue. TGC allows us to change the brightness levels at different depths in the image. So if you think of your TGC lever corresponding to this image here, so each lever corresponds to a different depth on the image. So if I move this lever here really far that way, this line of the image is going to get really bright. If I move this same lever that way, this line of information is going to get really dark. So it controls each horizontal line all the way down your image, the brightness level at that depth. So this helps us with attenuation because generally the deeper you go into the body, the brighter or more boost you're going to need in signal in order to compensate for that attenuation. And what's great about it, it doesn't change the sound, the strength of the pulse sent into the body, so you can adjust your TGC all you want, and it won't affect what you're doing to that patient. This is the second most used control on the ultrasound machine. We adjust it frequently as we're going along, and our goal is to get equal brightness from the top of the image to the bottom of the image. And by equal brightness, it means that each level should be the color that it is. So not that we want to make the glandular tissue the same gray as the fat, but we want the glandular tissue to be white, we want the fat to be medium gray, and the muscle to kind of be in between kind of thing. But we don't want any levels of the picture to look like this, where they're too bright. Or any levels of the image look like this, where they're too dark. All right, so we'll just finish this last slide tonight and then we'll be done. So output power is the third brightness control. Output power actually changes the strength of the pulse that's sent into the patient's body. So we really want to pay attention to the output power setting on an ultrasound machine. When you send a stronger pulse into the body, it means that you're getting stronger reflections back. So you're going to get a brighter image. When you're sending a decreased level of pulse into the body, you're getting weaker reflections back, so you're getting a darker image. So we want a output power that's strong enough to be able to see all the layers of the breast, that's not insufficient like this where it's too dark and we can't see the breast. But we always want to think about the principle ALERA. ALERA is our safety principle in ultrasound, as low as reasonably achievable. So when we're adjusting controls on an ultrasound machine, we want to really consider first the impact of the patient. So we want to use controls first that, like gain and TGC and frequency and focal zones, that don't affect the strength of the pulses going into the body, and only adjust output power as a last resort. Most ultrasound machines, though, today safely operate at 100% output power level, so most of the time we can, operate at that level and be okay. With the exception of possibly fetal imaging. We're really more careful with this when we get into that. All right. So this video is posted on Canvas. If you guys could get a chance to watch that before next class time, please watch that. 3 minutes. It is. So you'll find it posted under modules. So if you go to the, I'll look here.